Live streaming 24/7, playing old school versus new school. Follow us on Facebook, Twitter, Instagram at AAU Media, and visit our website www.aaumedia.com. Call us at 1-833-369-1444 extension 1 and leave us an inspirational message or request. You're listening to All About Us Radio.
Hello. I want to thank you for joining us this evening at All About Us Radio, where we empower women. I'm Dr. Monique Ford Jones, and I have the pleasure of having Dr. Marcia Green, who is a dentist, with us this evening. Dr. Green has led a successful general dental practice on Staten Island for over 30 years. She's a graduate of the Fairleigh Dickinson University in Teaneck, New Jersey, where she received her undergraduate degree, a bachelor's of science, and her doctor's of medicine in dentistry as well. She's continued to do postgraduate training in dental implantology as well as sleep apnea. Dr. Green prides herself in remaining current in the field by taking classes, therefore offering new treatment and innovative technology for her patients. She regularly speaks at health expos in New York and New Jersey. Outside of dentistry, Dr. Green is passionate about reducing malnutrition and overall health. She started a community garden to increase knowledge of healthy foods for her patients as well as the community. With the help of her friends, she runs the Callaloo Patch Community Garden, which brings fresh produce and nutritional education to the local residents. In addition, she serves her local community. Dr. Green also is a volunteer with various organizations that provide medical and dental services to underserved community in the Caribbean. And that is how Dr. Green and I reconnected in January on a medical mission in Jamaica. Dr. Green is the mother of one son and many Bayview children, and her practice is called the Bayview Dental Office. In her spare time, she heads to the sunny island of Jamaica, where she calls home. She attributes her strength and her success to her belief in God and to her mom, Albertha Bisson, who has been a constant pillar of strength and a guiding post for the family. So it is my pleasure to have Dr. Green as my guest this evening as we talk about a forgotten health, which is dental health. So, Dr. Green, thank you for joining me here today.
Thank you. It is my absolute pleasure to be here and to speak from the heart about something that we know is absolutely needed in our community. Thank you so much for the opportunity.
Oh, my pleasure. So, why is it that dental health is so important, Dr. Green?
Dental health is a gateway to your health, to your overall health. Dentistry and medicine are not disconnected and should not be disconnected. We should be corroborating patients' care. And especially in the area of sleep medicine is where we are cooperating now. But overall, the patients should be referred from their primary care physician to dentistry, just like we do every year. Should be an annual checkup. You have to monitor dental health. Very important.
Excellent. So, what are some of the most common dental issues you see affecting women, Dr. Green?
Periodontal disease, for one. Periodontal disease because of pregnancy. It's the ovaries are directly connected. The health of the ovaries and the health of the teeth are directly connected. There's an old wives' tale that when you get pregnant, you lose teeth because of the hormonal changes during pregnancy, the loss of calcium to the pregnancy. You don't recover up to about 18 months, I think I mentioned, the level of calcium that the body needs to operate optimally. And we know how important calcium is. So before you get pregnant, your calcium levels need to be optimal. And if they're not, and you get successive pregnancies without proper recovery, you're losing a lot of calcium. So here is your periodontal disease, your osteoporosis, your heart issues, all of it, and it cascades.
Dr. Green, can you explain to the audience what is periodontal
Periodontal
disease?
disease, what your grandmother would have called pyorrhea, or loss of bone around the teeth, and you get bleeding gums, bad breath. Mainly the loss of bone and the degree of loss can tell us very early what is going on with the patient's health.
So if a patient starts to notice, or if a person starts to notice bad breath or bleeding of their gums,
I would say bleeding of the gums is always an indication of an inflammatory process or inflammation in the body. It is showing up in the mouth, but it is in the body, mainly in the lower organs, the liver, the kidneys. Something is going on that is triggered, that is inflammatory. And if that is not handled, yes, it will show up in the mouth, but if you check the blood, there's something that is off. There's some markers in the blood that may be off. Maybe vitamin D, maybe blood sugar, it may be something related to atherosclerosis or calcified arteries. But something is going on in the body that is not functioning properly. So yes, it's showing up in the mouth, but the mouth is not separate from the rest of the body. We treat it separately, but it's not, right?
So you brought up a very important point, Dr. Green. So question. So when you have poor dental carie, how does that have an effect on other health conditions such as high blood pressure, diabetes? You mentioned, you talked about
All the
pregnancy.
metabolic diseases. Dentistry is a good indicator for all the metabolic diseases. We can see what is coming within 5 to 10 years from diabetes, especially diabetes. If the patient is having bleeding gums, it's not rectified or resolved with the normal dental treatment. For my female patients, I tell them, get your GYN checkup. Something is going on in the GYN genre that is not balanced. So maybe hormones, it may be fibroids, it may be some changes are going on in the female organ in the breast. I don't know what it is. I can't diagnose it, but I know on 35 years of experience, I've had women really, sometimes they ignore you and then they come back and say, oh, the doctor says I'm pre-leukemic. The doctor says I have cystic breasts or something is going on. So it's our overall health that's indicated in dentistry very early. That's why the 6 months checkup with a really savvy dentist is very important. We saw, not to change, but during COVID, dentistry became paramount. Dental health became paramount during COVID, and our community was on the left foot. We were behind. So we lost a lot of people because they were already predisposed to conditions that were just lucrative for COVID, for that COVID virus, the way it operated.
Interesting.
Yes.
So another question that I have for you, a lot of women are always afraid during pregnancy to go to the dentist because they're afraid they may get x-rays or need an x-ray. So can you speak to that?
Yes. In New York State specifically, you cannot take an x-ray on a pregnant patient. They shouldn't have any dental work done. I think it's 5.5 months. Sometimes a patient who has not gotten care will show up with a really bad toothache, and you have to get an x-ray. And at that point, you have to treat the patient. You shouldn't do anesthetic before 5.5 months or x-rays, no treatment at all. So what do you do if the patient is in pain? You have to take an x-ray by law. We're bound by the law, regardless of what's going on with the patient. So you have to get permission from the obstetrician, use a double x-ray shield and take that x-ray, because I'm not going to treat the patient without an x-ray.
And I understand what you're saying. I remember when I had my private practice, I would get a lot of calls from, dentists asking, is it okay to
Right.
shield them, to protect
You
them.
use a double shield, use whatever you've got to get, but I've got to get an X-ray, and if not, I won't treat the patient.
Absolutely. And I also want the audience to know that it is safe to have an X-ray in pregnancy
Well,
as long as
right
they're
now
shielded.
we're mandated to have digital X-rays, so you're not getting the exposure from dental X-rays that you used to. You're getting a millisecond, 4 milliseconds, or 2 milliseconds of exposure. You get more than that outside, or you're
From the
getting that from
sun.
your cell phone, right?
Absolutely. Absolutely. That is
So
so true.
I am not worried about it. The babies are exposed to a whole lot more on our cell phones and whatever media we're using while we're pregnant.
I agree with you.
So
And
I
it's
get very
also
cynical. I need an X-ray. I need an X-ray.
right. It's also important for them to know it is also okay to take antibiotics if there is a tooth abscess or a problem,
Right. You
as
have to give an
well.
antibiotic. I segue that to the doctor. I don't want to be responsible because some attorney will come back and say the baby had whatever during pregnancy. Now, during pregnancy, I believe it's tetracycline that will stay in the teeth, that will stay in the primary teeth of the infant. So you don't want to prescribe certain antibiotics. The teeth will come out blue. The baby teeth and even the permanent teeth, the baby will have blue teeth.
And that is why it's so important, like you said, to have open communication
Right.
with that obstetrician.
Right.
Because again, collaborating together
We need to know if the
makes for
patient is compliant, because some of these patients are not compliant. I'll tell them one thing and you'll tell them one thing, and then we both wind up in somebody's courtroom.
and we're not trying to have that.
No.
That's why open communication and
Right.
collaboration is so very important.
Yes,
And it's
absolutely.
and it starts from, like you said, early on, which is
Yes.
what's going to lead into the second half of our talk when I say having good dental hygiene early
Right.
on is so important.
We
So
recommend every 6 months. I say if you can't do every 6 months for various reasons, try to get into your doctor just like a GYN once a year. Right? It's no different. Health is health. So whatever your preventive parameters are, we should all be doing something to stay healthy.
exactly. Can you talk about flossing? It has become a lost art for people. So let's talk about dental flossing.
Right. Kids don't have dexterity. So the dental manufacturers have had to come up with different things. Nobody can floss. Only dentists can floss. Believe me. Trust me. Dentists and hygienists, we're the only ones that know how to floss. So don't beat yourself up too much. They have come up with different things where it's on a stick and you pop it in between the teeth. You have to get between each tooth on either side, get all the soft stuff up or loosen it so that when you brush or use your water pick or whatever, it's already loosened and you can get that bacteria out from between the teeth. That film, that bacterial film, which is plaque, and it sticks to the teeth, and that's what picks up the calcium in the saliva. That's what gets hardened, and that's what starts to deteriorate or destroy the gums, and that's why you get bleeding. So
Understood.
that is very important. But they've got a water flosser now. I think Philips or whoever makes it, they're on Amazon for a couple bucks, which is well worth it. You flush it out, and it's very nice, and it has a brush, and dental health now is a lot different than us trying to get floss up to the third molar.
Got it. So again, I want to transition into talking about empowering our women to empower our children,
Right.
right? Because again, like you said, dental hygiene starts from early on. And so once we start to develop good habits, we're able to continue those habits when we go into adulthood.
Right. It's
So,
basically the moms who have had bad dental care, they're afraid, so they pass it on to the children, and they bring the kid in only when the kid has a toothache because that's what they did.
so let me ask you this. I find some of our moms may have provide sweet substances, sweet drinks in bottles with their children. Let's talk about how that can affect
Well,
our
yeah,
children's
the
taste.
children should not get any sugary drinks to sleep. They're gonna be mad at you. They're gonna throw the bottle at you, but give them plain water. Put nothing in that bottle because you're gonna get what we call it's a syndrome where all the anterior teeth are rotted. It's missing my mind right now, but you get this bottle syndrome, or because the child is sleeping with a bottle close up on the teeth with sugar, with milk, chocolate milk, whatever it is, and it destroys the entire upper front teeth and the lower front teeth. And those teeth are what shapes the face. Those are the teeth that help you to speak clearly. So if the kid loses these teeth at 2, they don't come in until they're 5 or 6 years old. Those upper and lower anterior teeth, some of them 8 or 9 years old. So if I got a 2-year-old with bottle rot syndrome, as they call it, what do you do with that child? The child goes, and now it's starting to go to school, 2 or 3, and they have no teeth. So we wind up with self-esteem issues. The child might have bad breath. Nobody wants to get close to the child. So that's the one part of it. The other part of it, it affects the development of the palate. It affects the breathing, the child's breathing. So here you get into cognitive issues. And other, so the child is malaise, no energy. Nutrition is an issue. They can't chew, and they're not swallowing properly.
So you brought up 2 important points. You talked about it could have some hindrance and some issues with developmental
The teeth,
growth. So let's talk about that first.
right? The teeth on a whole, the tongue in the mouth is a couple of things. You've got the tongue, you got the lips, you got the jaws. What we're seeing in children now, and I have not seen in 30 years of practice, in almost every other child that comes in, the tongue is tied to the lower, tethered to the roof, the floor of the mouth. So that's ankylosed tongue. That affects the speech. Without teeth to block that tongue and keep that tongue in the mouth, the tongue is pushing out of the mouth. So now you have a kid that's drooling. You've got a kid that cannot control the tongue, and the lips are pushing. The tongue will push everything forward because it's a powerful organ, powerful muscle. So you've got a face that is being developed at the critical time of development between 3 and 8, 7 or 8. That's totally distorted and abnormal.
So another question that I have, because it bounces off of what you just said, sometimes our children are being labeled as developmentally delayed. Do you believe that some of this may tie into some of this dental,
Absolutely,
poor dental
absolutely.
hygiene?
All the D's, all the ADD, ADHD, some spectrum of the autism spectrum, some part of the autism spectrum is all related. There's a dental component to all of those behavioral issues: bedwetting, sleep, shaking leg syndrome, all of it.
Interesting. That's really important because, again, sometimes it may be something that we can prevent early on, and we may be causing a hindrance for our children. Okay, so it's so important. What should the mothers look for?
Well, the children anyway, when they're sleeping, are they grinding their teeth? Is the child closing do they have issues breathing? Can they breathe with their lips closed, or are they breathing with their mouth open? Is there a reason for that? Right? Many of the kids will grind their teeth at night. They can't close their lips. When they swallow, sometimes they're not swallowing properly because the tongue can't move correctly in the mouth because it's tied, or they're not speaking clearly, so they put them in speech therapists, but the speech therapist is not looking or connecting to the dentist or my functional therapist. They're doing speech, but the child's tongue is tied. So you're tying into nutrition because the tongue can't move the food to the back of the mouth properly. The same child might have tooth decay beyond one little cavity, so they're having pain, they can't chew. So their nutrition is poor, the digestive system is not absorbing anything because the food is either going in big lumps or they're just not eating. So the child is malnourished.
So let's talk about how malnutrition, because of poor diet and poor dental hygiene, can affect our communities.
Well, what you'll see is what they call delayed development. And it's because when the child has cavity or they have I call it lack of airway. The airway is not sufficient. The child is not breathing properly because the dental component or the craniofacial development, the face, muscles, teeth, jaw, tongue, is not properly developed. So the child is not getting enough oxygen. So they may be gasping for air, but it's not obvious, right? So they're not, you watch their breathing, they're hyperventilating or they're just not breathing properly. So they have some type of sleep disorder breathing that has to be diagnosed by a physician in coordination with the doctor. But once that is occurring, it means something. If you look at the airway, the posterior airway where the air goes into the lung, it's narrowed because of the development of the jaw. So the child is not getting enough oxygen to the brain. The blood is not picking up enough oxygen. So therefore, the rest of the body is not getting, the hemoglobin on that child might be low.
Got it. So what would you tell a mom to look for? You one of the things you brought up is to assess them when they're sleeping. How
Right.
about when they're awake? What should moms look for?
Can the child breathe through their nose? Nose breathing as opposed to mouth breathing, two different things. The child has a cold and they can't breathe, the nose is stuffy. Sometimes you have the bridge of the nose may be obstructed, right? The airway, the nose is blocked because of the bone or something may be off. Some development in the nasal passage might be off. If you're breathing through the nose, you're getting there's nitric oxide in the follicles, the hair follicles in the nose, right? So when you breathe through your nose, the nitric oxide will clean the air that is going into the lung. If you're breathing through the mouth, the bacteria in the mouth is not so good, right? So you're taking air directly into the mouth. It's not being cleaned. There's no nitric oxide in the mouth. So it's going into the lung with a heavy load of bacteria. So there goes your asthma, there is your bronchitis, your frequent respiratory issues.
So Dr. Green, that's very, very interesting and important because they found that a lot of kids are getting increased asthma over time,
Right,
based on environmental issues, but maybe, I don't think a lot of people correlated it to also the dental part of
right.
this.
The nasal passage is very important to get the kids early on. That's why we do a myofunctional treatment, which is a small silicone device which you put in the mouth. It shapes the palate. It helps the kids to put the tongue to the roof of the mouth and close their mouth and breathe through the nose. It's a training device and it helps with growth and development. But our community that's used in Europe and Japan and other areas. And in the United States, we're focused on treating the children at age 13 for orthodontic treatment, which will correct the teeth. We only focus on the teeth. We need to be focused on the muscles, the jaw, the tongue, and the facial structures when the child is as young as 3 years old.
So you brought up a very important point because you said we need to be developing this when the kids are about 3 years old. When do you recommend a mom taking their child, empowering that mom to take their child for their first dental visit?
Right. On the whole, we're recommending 2.5 to 3 years old, depending on the maturity of the child. I work in Staten Island with Rumsey Hospital, which is across from me, Dr. Mendez. We're seeing the kids when she gets a chance from 19 months. And it's basically for observation. We have a program called the Well Child Program, so I'm the dental component for that. We look at the children at 19 months, just looking to see the tongue in the mouth, how is it going, can the child swallow properly, any developing caries, and just to help the moms to brush the teeth or use a washcloth or whatever they've got to keep the mouth clean, keep the child clean, and a little bit on nutrition. So that's what we're doing. But on the whole, 2.5 to 3 years old, just for observation. 3, if they're mature, we can start to introduce a little bit of cleaning and, teaching the moms teaching the child how to keep their teeth clean and why they should keep their teeth clean. And they have cute little brushes and all kinds of stuff, just use something.
So I want to take it back to the adult for a little bit because
Right.
again, to teach the child, we have to make sure the adults know how to properly brush, right? So what would you suggest and how would you counsel a person, whether it's an adult or a child, on brushing?
Um, you use anything that the child likes. A regular toothbrush, any size tooth. They have toothbrush for babies. They've got toothbrush for 7, 8s, and they've got toothbrush for teens. The little ones, they've got cute little caricature on them and whatever. So use that. If the child has a specific toothpaste that they like, and I don't really care, use whatever the child likes. In the handicapped population, there are brushes that are specifically geared for them. They have two sides of the brushes that move, and the moms have to help them. So there are brushes out there specifically for different people, different situations. The moms just have to get the kids set a specific time, bedtime, when they're bathing or whatever. Brushing is part of it. When they wake up in the morning, brush your teeth. They don't have to brush 3, 4 times a day, but they need to brush specifically at night. And when they wake up, you brush and clean your teeth before you go to school or go out in the day.
Let's talk about our adult population.
Right.
You know, there's so many different types of brushes and bristles, soft, hard, firm.
Right.
What is the recommendation and why are there so many different choices?
Right. We recommend soft because you brush longer. The brush is hard. It feels good, but you're going to think you brushed really well because you're going to swish around for 2 seconds. If the brush is soft, it doesn't feel like you're quite getting it. So you're going to brush a little bit longer so you get the plaque off. The most important thing is to get the plaque off the teeth. And you have to brush all the way in the back, close your jaw so you can get the brush back there and really brush really well. Especially on the upper right and left and the back molars, people just have a really tough time getting back there. But you know, when they go to the dentist, the hygienist usually will go over how to brush.
Yes, you know, it's so good and it's so important. Our goal is to get the both the moms and the children into the dentist's office.
Right.
But there are so many people that have a fear of the dentist. So I'm trying to also touch
Yeah, I
upon.
recommend the younger children, if the parents have the pediatric dentist, most of them do not take insurance, so it becomes a little bit prohibitive. I don't know. They could call the pediatric dental offices and see if they take their insurance. But find a doctor that likes to treat children. Find a doctor, a dental office that treats children. That may not be a pediatric office that may work with your insurance. Our community is very limited by the insurance that the doctor takes.
And I think that may be one of the factors why people also may not go to the dentist. They're afraid of well, not just that, not being able to cover the cost.
Right. The cost is prohibitive. We don't have it. I think we have more minority dentists now, more women dentists, but people just are not comfortable. They're not. I'm on Staten Island. I'm it. I am the only black female dentist here, black dentist here, period. And in 30 years, it's been 5 of us, 4 of us at one time, maybe.
Oh, that's impressive. That's good to know.
So people need to look in the community, make the calls, find somebody who you like. It doesn't have to be your same color, ethnic group, whatever. Find a dentist that you like that matches your personality. Dentist is like your GYN. It's like your hairdresser. It's a personable, up in your face kind of profession. Right.
So we're going to take a short break, and we're going to come back to talk about calcium and fluorides and some of the recommendations. So we're just going to take a short break.
Okay.
Hello, this is Najesti from Butter Me Essentials, Natural Hair and Body Company. We are located in Brooklyn, New York. We are a family-owned company, which is run by my husband, Vaden, and I. Do you have hair that is hard to manage? Having trouble with hair growth? Is your skin always dry? No problem. Butter Me Essentials is here with the solution. We specialize in hair butters, pomades, hair elixirs, shampoos, conditioners, luxury soaps, body butters, lotion bars, perfumes, scrubs, and so much more. All of our products is made with natural and organic ingredients, such as shea butter, cocoa butter, mango butter, Jamaican black castor oil, avocado oil, Oregon oil, and essential oils. There is no sulfates, petroleum, mineral oils, or parabens, just all natural goodness. If you would like to order our products, check out our website at buttermeessentials.com, buttermeessentials.com, or call 646-524-3351, 646-524-3351. Check us out on Facebook and Instagram. Remember, like our motto says, you deserve to be buttered.
So, Dr. Green, welcome back. Dr. Green? So,
if I lift up my heart to you, if I open my mouth to give you the glory, it would be hallelujah. We sing
So, Dr. Green, prior to our break, we were talking about dental hygiene for both our moms, as well as for our children. So, can we talk about supplements, vitamins? Are there any recommended vitamins that you would recommend for, let's talk about our moms, our women? Seems like we have a little technical difficulty. We can't hear Dr. Green. I know one of the things that Dr. Green and I did speak about earlier was the fact that how fluoride treatment is so important for both our adults as well as for our children. So one of the things that she spoke about is after people are brushing and washing their mouths, they might want to consider some form of a mouthwash that may have fluoride in it, and that how it is important to use calcium and calcium supplements to help with the periodontal issues, to strengthen the bones, and so that you don't end up having osteoporosis in that bone line where you can end up losing teeth. So it is so important that we consider using nutrients and using additional supplements, especially if our women are getting older and they've gone for a bone density and we've started to see some signs of bone loss on the bone density. We call that osteopenia, where we start to have bone loss as it's there. One of the things that is mentioned is we also need to increase our vitamin D intake, and it's important to make sure that you can have good nutrition, and we can also get that in our diet. So it is so imperative that we can make sure that we give what is needed to all of our people and our community. So I want to touch bases back with Dr. Green. We're going to take just another short break.
You're listening to All About Us Radio. We're live streaming 24/7, playing old school versus new school. Follow us on Facebook, Twitter, Instagram at AAU Media, and visit our website www.aaumedia.com. Call us at 1-833-369-1444, extension 1, and leave us an inspirational message or request. You're listening to All About Us Radio. You're listening to All About Us Radio. We're live streaming 24/7, playing old school versus new school. Follow us on Facebook, Twitter, Instagram at AAU Media, and visit our website www.aaumedia.com. Call us at
I just want to confirm that you can hear me and that my mic is back on. Excellent. So, Dr. Green, are you on? Okay. So it seems like Dr. Green's mic, we have lost our mic with Dr. Green, but we are almost to the end of our show. And it's been a pleasure having Dr. Green, but one of the things that we wanted to discuss is how important it is to have a base of community and population health. And I know that this is extremely passionate to her because, again, she has this Callaloo garden patch that she brings the nutritional education to the community and to her patients. And it is my understanding, and we also know that Callaloo is rich in nutrients and in vitamins. And so that is extremely important. And that there are so many natural foods that people can eat to help with dental hygiene. But it is also important that I reiterate some of the key points that Dr. Green spoke about earlier. That is going to the dentist early. It is important for women, if they see that they have any bleeding gums, if they have any foul smell in their mouth, that is an early sign and trigger that there might be something else going on, some other health related issues, and the need and the importance to start by seeing a dentist. One of the things that Dr. Green also mentioned was the fact that we may not be so skilled with flossing, and that they have so many devices that are out to try and decrease down the plaque and the decay. And that they do have things out that people can buy on Amazon. She mentioned that it's not that expensive, like water picks. and that they have handheld devices to help with flossing. It is also a key point that she brought up was using a soft bristle, because you will tend to brush longer by using a soft bristle, and that you make sure to close your mouth, get the back teeth, front and back, and to do things in quarters: top upper corner, top left corner, work your way to the bottom, starting midline, working your way all the way from midline back to the molars, and the same on the opposite side, as well as the inside of the teeth. That's where things tend to harbor and fester, and that is food. It is important, Dr. Green also mentioned, that you brush morning as well as at nighttime before you go to bed, and to start to get into a habit while doing that, because of the fact that you don't want to go to bed and have something sitting on your teeth while you're sleeping, eating away and decaying at your teeth. And it is also important that we start to teach our children early proper dental hygiene. I was wishing that Dr. Green's mic was back on, because one of the questions that I wanted to ask her that she mentioned earlier is that sometimes speech pathologists work with the children. And I'm going to probably have to have Dr. Green back on our show, because I think dental hygiene is extremely, extremely important. And I wanted to find out, does she think we should have maybe early on into the school system, maybe introducing or having some of the dentists come into the school, not even to just give lectures, but to work with the speech pathologist to possibly start doing exams within the community, if permitted by the parents and the school district, to see if we could start to improve dental hygiene and dental structure, which is what she mentioned earlier, at an earlier age, to try and decrease down the labels that our children are getting regarding developmental disabilities. So I'm going to see if we have any questions in the chat that we can come up with. Does anybody have any questions that we could address? So New York has a program for prevention, but not for development, which is quite interesting. Is there any way, or can you think of anything that we can do to maybe take it to a state or a governmental level that we could start to address this for our communities? Do we think we should reach out to legislation to try and speak to and get some bills on there that we can help our moms and children? So I'm sure there are some granted fund programs for seniors without dental insurance. So I do believe that some of our seniors, as well as our children, like Dr. Green said, can be seen in some of our dental clinics, and that provisions can be made for them to get dental care, as well as our younger adults, as well as our children. We would need to write proposals to try and get some of these grant fundings. And this can then show the importance and the need for early startup. So I think this is extremely important, because again, one of the things that Dr. Green and I spoke about earlier when I was trying to ask her to be a member on this podcast was, what are some of the things we could do to make it better for our community? And she was so passionate about the children and making sure that our children do well and grow, and that their structure of their appearance and their gums and their palate start early, so that they don't start to develop chronic illnesses and diseases that could lead to issues as they get into adolescence and adulthood. So I know the passion that Dr. Green has for our children as well as our adults. So with that in mind, I'm going to see if we have any more questions that are coming into the chat. All right, excellent. One of the things that was mentioned is also sometimes having poor dental hygiene has such a major effect on the aspect of our society. It has also been linked not only to just health, but also to crime. So I know when we think about things and we think about life, we don't think how everything is connected to one another, and how something so important as the first thing on our face, how we speak, what we say, how we look, all starts with our mouth. It is the temple of the rest of our well-being. So with that, it is so important to have people like Dr. Green and dentists that specialize in this field. And as you see, her information is up on our chat here. So please feel free to reach out to Dr. Marcia Green, located in Staten Island. And as she said, she is the only African-American female in all of Staten Island. So her address is 736 Castleton Avenue, Staten Island. And that phone number is 718-273-8886. I believe that is correct. Dr. Green, it was such a pleasure having you on today. I'm sorry we had technical difficulties, but again, the part that we could hear from you was so important and so imperative for both our mothers as well as for our mothers empowering our children. So again, thank you again for a lovely evening.
Throw and Tuck. It's handmade by myself, and you only can get it here, and it's patent, and it's only here at Rococo Design. It's like a regular pillow, or you can take the blanket out like so, fluff up the pillow, open up your blanket, wrap it around yourself, and then you can lay on your sofa and relax with your pillow throw and tuck. When you're done with it, just flip it over. When you don't want the blanket anymore, you just fold it over twice. Fold it over twice again. Fold it over. And tuck it in the back. And there you go. You're back to the pillow throw and tuck. Rococo Design.